Hi everyone, welcome to new video. I'm Dr. Ranjit Ravella from MedRewind. So today's topic of discussion is lead poisoning. The whole source, whichever we are going to discuss, is from New England Journal of Medicine (NEJM). The images which I have shown in this presentation is also from NEJM. I have tried to concise the whole article into 8 slides, but if you want to read the whole article, you go back to nejm.com and try to read the whole article. Definitely, lead poisoning is very important for discussion. Lead poisoning is a silent threat to health. We have seen that lead poisoning is a pervasive health concern affecting millions globally. The acute symptoms include fatigue and headaches, and also the chronic issues can include from cardiovascular health to cognitive decline, and lead exposure can also lead to kidney impairment also. So this presentation explores the multifaceted nature of lead poisoning, its sources, effects on body, and strategies for prevention and treatment. So definitely we have seen some symptoms and acute effects which are seen with the lead poisoning. The overt lead poisoning can cause some acute symptoms such as fatigue, headache, irritability, and intense colic with constipation. Whereas severe cases can we can see that there is seizures, encephalopathy, and death at blood lead concentrations exceeding 800 microgram per liter. Chronic poisoning, we can see Burton's line. If you see this image, this is Burton line. There is thin bluish deposit along the gingival origin. There is accumulation of lead sulfide along the gingival margin, which causes the bluish tinge in the gingiva. So, coming to the other slides, the long-term health impacts include cardiovascular impacts. It also causes kidney failure and hypertension. So, cardiovascular disease, it is a major risk factor for adults, even at previously thought safe levels. And cognitive decline, significant impact on children's cognitive development is also seen with lead. Again, chronic kidney disease, increased risk at commonly found lead concentrations. When I was discussing with my nephrologist, he has suggested that even people who are using cosmetic creams, there is an increased risk of chronic kidney disease if there is significant lead concentration in the facial creams. Preterm births, yes, higher risk is associated with lead exposure in pregnant women. So coming to the global impact and sources, of course, in 2019, lead exposure accounted for 5.5 million deaths from cardiovascular disease and an annual loss of some 65 million IQ points in children globally. The common sources, if you see this image, the common sources include the paint, lead paint, soil, and spices which we use daily. There are some spices which are adulterated with lead, and battery recycling and smelting factories, tobacco, aircraft emissions, and lead service pipelines are some of the important common sources. We also have to think regarding the electronic waste, ceramics, and other spices in many countries. Again, environmental factors which can include lead service lines, proximity to airports. Living proximity to airport also has an increased risk of lead exposure, as the fuel from the aircrafts contain significant amount of lead, and other sites emitting lead pollution increase the risk of low lead level lead poisoning. Low level lead poisoning. Coming to the exposure and absorption, definitely the exposure can be through either inhalation or ingestion. Absorption, it is readily absorbed by infants significantly if their calcium or iron deficiency is there. They have increased risk of absorption of lead. Cellular entry, lead usually mimics calcium and iron, and zinc enters cells through calcium channels and metal transporters such as DMT1. DMT1. Body distribution, 95% of lead is stored in adult skeleton, whereas 70% in children's skeleton. Only 1% is found circulating in blood. Coming to the effects in children, of course, as we have discussed previously, in pregnant females, if they are exposed to lead, there is high chance of preterm births. Cognitive deficits, definitely higher lead levels associated with neuropsychological deficits and unfavorable teacher ratings. Behavioral issues, risk factors for antisocial behaviors, conduct disorder, and criminal behavior is seen in people who are at high levels of lead exposure. Brain structure, reductions in brain volume persisting into adulthood. ADHD, there is increased risk of attention deficit hyperkinetic disorder in children. And two major organs which are affected with lead is cardiovascular and kidney effects. Definitely, there is increased risk of atherosclerosis as mentioned in the article. You have to read the whole article to understand more about cardiovascular and kidney effects. Summarizing the effects, there is increased oxidative stress, reduced nitric oxide levels, and vasoconstriction and atherosclerosis promotion is seen with lead in cardiovascular effects. Whereas kidney effects, there is intranuclear inclusion bodies in proximal tubule cells, tubulointestinal fibrosis, chronic kidney failure, and reduced glomerular filtration rate is seen with lead. Coming to the last slide, screening and treatment. Screening, most important, it is recommended for high risk children and adults, including those with suspected exposure or unexplained symptoms. Specifically, you need to find out where they are working. If they're working in a factory where they're disposing the electronic items, I think these people are at higher risk, or they're staying in proximity to airport. I think these people need screening. Coming to the chelation therapy, usually what we use is EDTA once weekly. Again, it is very effective in reducing blood lead burden, but findings on health outcomes are inconsistent with the therapy. Coming to most important part, it is prevention. Primary prevention is critical due to inconsistency of efficacy of chelation treatment. It is primary prevention which is very important to avoid using the spices which have lead or the cosmetics which have lead in them. So I think this is the summary of my presentation of lead poisoning. Thank you so much.